If you're a male and you have feeling of depression, you are obese, you have loss of interest in sexual intercourse, you have erectile problems, you have low energy, you're not able to focus very well, you may be having testosterone deficiency. If you want to know what is testosterone, what are the signs and symptoms if you have low testosterone levels, when does a doctor suspect that you may be having low testosterone level, and who should you see if you are having this problem? If you want to know this and more, go through this video. I'm Dr. Aarti Deendayal from Mamata Fertility Hospital. I'm a fertility expert, and I'm going to tell you all you need to know about testosterone deficiency. Now, what is testosterone? Testosterone is a male hormone which is responsible for male sexual development and male behavior and testicular function. That means it helps a young male to mature. It is responsible for the growth of body hair. It is responsible for deepening of a male's voice, and it also helps in the production of sperm. So what happens if this hormone is less? The male may feel very tired, low memory levels, very depressed, feeling very tired all the time, may have erectile issues, loss of body hair, lesser beard. These are just few of the signs and symptoms of low testosterone levels. Why does this happen? It may happen because maybe the male is having some genetic abnormality. They are born with a genetic syndrome because of which testosterone level is low. It may be because there has been some sort of injury to the testis because of which the testis is not functioning very well. It may be because the man has taken some chemotherapy or radiotherapy in the past for some sort of a tumor in the testis. It may also happen if the male is taking very long term antidepressant medication. And do you know that even many of the men who have HIV may have low testosterone levels? Do you know when a doctor suspects that the man may be having low testosterone levels? Of course, if the man is giving all these symptoms, we will suspect that maybe there is low testosterone level. But also if the man is having low hemoglobin levels, they are young, diabetic, or if they are getting fractures very easily with very minimal trauma, if they are having infertility issues and very poor sperm count, or if they are HIV infected, if they have a history of radiation or chemotherapy taken in the past, this is when we doctors suspect that maybe they are having associated low testosterone levels. Do you know what is done usually in this condition? Yes, there are options of treatment depending on what is the problem or the symptom the man is facing. But more importantly, if you are facing any of these symptoms, you need to see either a andrologist or you need to see an endocrinologist, a hormone specialist who will examine you, go through your history, and then advise certain investigations for you. And depending, again, as I mentioned, depending on what is the complaint, what are your symptoms, they may advise you specific treatments to help alleviate your symptoms and improve your general condition. I hope this information was helpful to you. And if you are having any of these symptoms, and if you're even doubting that you may be having it, do not self-test. Go and see a specialist who will then guide you forward and make the right diagnosis.